definitely what we're going to talk about today is not limited to nursing. It has a lot to do with community health, public health, environmental health, things that impact health, even health policy. As you see, Leanne changed her last name to voting. So that's what we're going to talk about today. But just to give you, like I said, my background, I am a nurse from the School of Nursing. I've been a nurse for 30 years. I've been at ODU actually for 20 years, originally part-time, and then I've been full-time for several years now too. So let me share my screen and let's get started with, there we go. I hope you guys got a chance to watch the video that I put up. If you didn't get to see it already, a video that we shared is called Place Matters. And in that video, what I hope your takeaway that you get from that is it's not just your health habits. We put on, some of you put on here things like exercise regime and smoking and diet. Those are a lot of personal choices that impact your health. But then some of you put things on here like smog and food deserts and community safety and gun violence. Those things impact your health, I would say probably just as much as some of your personal choices. And I think that's, a lot of times we do attribute health to the decisions we make when sometimes they really have nothing to do with the decisions we make, but more to do with where we live, work, and play. So that's what we're going to talk about today is how does your zip code and where you live, how does that impact your health? So I started off with, I thought about, what if your zip code, what if your birth certificate had an expiration date based on where you live and work? So I went with like Big Blue. Big Blue was actually born in 1971 and became a mascot for ODU in 1971. And we're going to say he was born at Norfolk General Hospital in January. Usually lion cubs are about 3 pounds. But what if his birth certificate had an expiration date? Now, in the chat room, what do you think the life expectancy is in Norfolk if you were born now? 75, that's pretty good. 75, 70, those are pretty good, all right. 85, all right, let's take a look. Here is Big Blue's life expectancy. If you're born in Norfolk, your life expectancy is 75 years old. Virginia's doing pretty good. If you're born in Virginia overall, your life expectancy is 79 in comparison to the life expectancy in the US of 78 years old. Did you guys know there's actually a website that can allow you to just type your zip code in? And it can tell you what your life expectancy is. Here it is. So I typed in, so I'm going to ask somebody to give me their hometown in a little bit. I typed in my hometown. I'm going to compare that to Big Blue. I grew up in Sumter, South Carolina, 8 Dixie Drive. Now, if I was born the same time as Big Blue, my life expectancy in Sumter is only 69 compared to Big Blue's of 75. In Sumter County, a little further, 75, and South Carolina, 77. So just a little bit of a difference right up the road. So this is a life expectancy map here. So take a look at Virginia. We're okay, we're doing pretty good in the light blue range, which means our life expectancy is in the 70s. Darker blue though, 70 to 75 or so to 81. Look at these red counties. So if you're born in those counties, your life expectancy is actually less than if you're born where we are, born here in Virginia. And my home state is one of the red states, so not doing quite as well, where my life expectancy it might only be 75 to 77. Or in this state, life expectancy of 56 in the same United States that we live in. I did a comparison of a couple of counties here. McDowell County is a county in West Virginia that I go to pretty often with my church. Look at the difference in life expectancy of McDowell County, West Virginia, and Wake County, an affluent town in North Carolina. Just really, they're about 10 hours apart from each other. And the life expectancy is a 12-year gap there. So this is surprising to me. I don't know if I'm surprising anybody. But we talk about those being 10 hours apart. Look at this map. This is just a map of neighborhoods. Neighborhoods in Chicago has a life expectancy gap of 30 years, just living in different neighborhoods. So somebody's last name, you change your last name to even community safety or gun violence. Look how that might impact where you live. If you took an overlay even of this same map and put in factors like high blood pressure, obesity, even things like best school districts, and it will line up with the same map with those that are living in the 80, 85, and 90-year-old areas are going to have also the best school districts and the best grocery stores and the best healthcare centers, where you'll find those with the life expectancy in these redder zones that are 60, 65, 70 are going to have probably not very many, not the same choices for grocery stores, or maybe not even the same choices for public transportation. Things like that right here in one little town of Chicago. Let's look a little bit around the world though. Does this surprise you at all that the life expectancy in Central African Republic is 52 years old, almost 53 years old? I can tell you it shocks me because I'm 53 years old. So already in some parts of the world, I've already reached the life expectancy here. In the US, it's around 78 or 79, but we're not the highest by far. Hong Kong is actually at the top of this list with life expectancy in the 80s. So this is where we get to think about this a little bit. We're going to do this in the chat box as well. What are some of the factors that impact health and longevity? Now you guys did that with your name change, but we're going to kind of do an I Spy. So look at this neighborhood. If you lived in this neighborhood, if this was where your housing was, what do you see in this picture? And you could put these in the chat box. What kind of things about this picture do you think impact health? Access to grocery stores with, let's see, with fresh produce. The factory. So one thing I see about the factories are the potential smog coming from the factory, but also what about employment? Hospital nearby, pollution from cars, living off a main road, that could definitely impact it. Transportation to travel safely. Let's see what some of the others are. Emissions. Those are some great ones. Let's see if we can come up with a socialization with neighborhoods, social interaction. We think a lot about that with COVID right now too, don't we? That might impact our mental health outcomes. So access to Wi-Fi, internet. Leanne put that one on there. We're actually starting to have a lot of lectures about that now. And with COVID, we're thinking about access to Wi-Fi and internet as the digital divide. If you guys didn't have access to Wi-Fi and internet, you wouldn't be able to be here today to increase your education. Increasing your education, I'll show you a slide here in a little bit, impacts your health. So not having internet actually impacts your health. Not having access to telehealth services impacts your health. Entertainment, housing, no trees. Yep, no trees, Chavez, in this one. So that might impact air pollution and smog and things like that. And this little, what do we, this tower here might represent that digital divide, lack of internet, or this tower with the cell phone reception. All right, employment. Do you guys see employment in this picture? Your occupation impacts your health. Your income impacts your health. So those could be two different things, your income and your occupation. I don't really see schools in this picture. I don't know if any of them look like schools, but we'll assume there's a school in here somewhere. All right, next one. So these are some of the factors that we classify, all those things that you guys just mentioned. So again, we're not really talking about the personal choices. We're not talking about what you choose to eat or whether you go for a run every day or whether you have a choose not to smoke or do drugs or things like that. We're talking about things that you can't impact, but the things that are around you, such as economic stability, that might impact your health. The economy of a country, I'll show you a picture here in a little bit that's coming up too, but the economy of a country impacts health. So that's why we might see something like the US, which has a pretty good economy on a global scale, with a higher life expectancy than a country like Central African Republic that is much more resource limited and has a lower economy. So not just economy, but all those factors work together. Social and community context, neighborhood and environment, access to health care, and education. All those are factors that impact health. This gives you some examples under each of those. So we'll talk a little bit more about these, but under economic stability might include whether or not you're employed, your income, whether or not you have housing. Housing impacts your health, even parks and safety. Now, some of you guys listed things like Anaya listed a workout as something that impacts your health. But what if you don't have a good place to work out? What if you don't have access to gyms or access to parks and playgrounds, walkability scale? I know that I'm fortunate to live in a neighborhood where we have really wide streets and sidewalks. So it's really easy for me to just walk out the door and go for a nice, comfortable walk around the neighborhood without having to worry too much about traffic or being safe on the road. Hunger, so I put hunger in my, or I actually put access to healthy options as my name change. I changed my name to Janice Food Deserts. Where you live sometimes impacts the food choices that you have. I'll just tell you one story of grocery shopping even nearby. Again, I'm really fortunate to live in a nice neighborhood and have access to a farmer's market. You know, every Wednesday and Saturday I can go to a farmer's market and get fresh vegetables. And when I go to the grocery store, really every kind of vegetable you can think of is there as an option. Vegetables I've never even heard of are there as an option. I was shopping with my husband a couple years ago, and we wanted to stop by a grocery store just 2 hours from here in a small rural community in North Carolina. It just happened to be where we were at the time, and we were going to pick up a few little groceries. And the one thing that I wanted on my grocery list was a red bell pepper. Red bell pepper is pretty normal to me. I don't know about you guys, but I mean, I buy red bell pepper pretty much every time I go to the grocery store. And before we went in, my husband said, they're not going to have a red bell pepper here. And I thought, well, that can't be true. Every place has a red bell pepper. Well, sure enough, when we went into this grocery store in this very small town, rural community with a limited socioeconomic, more socioeconomically depressed area, no red bell pepper. In fact, every single vegetable in the produce section was essentially kind of a pale green. They had cucumbers, they had cabbage, they had green bell peppers, but that was it. Nothing like what I'm used to, which would be things like carrots and beets and yellow squash and just a whole colorful produce aisle. Take a look at this, this next column where you'll see community and social context, and look at the one almost at the bottom, discrimination. We're going to talk about that. That's not something that I saw anybody change their last name to, but do you think discrimination impacts health? I mean, I got it on the slide now, so the answer to that is probably yes. But let's talk a little bit about that. This is actually something we're looking at in our home state of Virginia right now, is the maternal morbidity and mortality. So the good news is that globally, since I was in nursing school 30 years ago, maternal mortality has actually dropped or improved by 45%. But we still have women dying in childbirth at a rate of 33 women an hour around the globe. 33 women an hour die in childbirth. But even more alarming than that, look what percentage of those are either Black women or American Indian or Alaskan Native women. Look at the change in that. If you're Black or American Indian or Alaskan Native, your chance of dying in childbirth is 2 to 3 times that of white women. And what are some of the things that are associated with that? I went to a lecture here, I don't remember if it was last year, this Linda Villarosa, and it was offered by the College of Education. And she is an author for the New York Times, and she wrote this article, Why America's Black Mothers and Babies Are in a Life or Death Crisis. And well, I would recommend that all you guys go back and read this article, which I thought was really, I think what our takeaway today that I really am hoping that, that you walk out of this with is there are multiple factors that impact health. And in this case, one that I'll admit it to say it, that I don't think I ever quite realized race as a factor, or I'm sorry, racism as a factor over race. So when I went to nursing school, and something that we know today, so Ariane and Chavez already know this. If you're a black male, your chance of having high blood pressure is greater than everybody else. So your chance of dying of stroke, if you're a black male, is higher than everybody else. But when I was in nursing school 30 years ago, we associated that with race. So that there's some factor in your genetics that that causes you to have higher blood pressure. Well, that is definitely true related to some things, such as we do know sickle cell is linked to to race. We know things like hemophilia are linked to race. But when it comes to things like high blood pressure, what we really started to figure out is it has less to do with race and more to do with potentially racism. So if you're a black male, your experience in your life and the disparities that you've lived in, so chances are that you have had other disparities maybe related to your occupation opportunities, your educational opportunities that ultimately impact your health. And we came up with that same idea. Linda Villarosa actually shared the concept of weathering. So weathering, when I think of weathering, I think of the way a house weathers. And so if you live at the beach and you have continual weather episodes and the rain and storms and things like that, the paint starts to erode, the wood starts to erode, and it changes the way that wood ages, if you will. Well, if you apply that concept of weathering to people, then the definition of weathering related to health is continual stressors, chronic stress brought on by disparities, socioeconomic disparities, might prematurely change your life expectancy. So let me give you a couple of examples of that. I think I was going to talk about them here. After I went to Linda Villarosa's presentation, I went and looked up some articles. I went back to the literature and read on that. And let me give you one example of how stress might impact health, and then relate that back to chronic stress. Before 9/11, one study did collected all the birth weights of babies of women with Muslim names. And after 9/11, they compared that same group of women. So if you, I mean, a different group of women, but a comparable sample of women that gave birth after 9/11 that had Muslim sounding names, and they had lower birth weight babies by comparison. So I hope you're following that. Basically, what they were relating that to is the stress of 9/11 and the racism that occurred after 9/11, because right after 9/11, people were really scared of Muslims and were actually quite, there was a lot of racial bias against Muslims after 9/11 occurred. And that impacted these women who gave birth to lower birth weight babies. A similar research study in a town in the Midwest, I think it was Idaho, I don't remember which one, measured birth weights before and after a traumatic immigration raid in the Hispanic community. And after the immigration raid, birth weights were lower. And this didn't matter whether the Hispanic women were US citizens or not, but the stress of that community actually lowered the birth weights of their babies. So this just gives you, speaking of racism in lowering your overall life expectancy, this is the life expectancy if you're a black male compared to a white male, a black female, and a white female. So now in 1970, if you were a black male, you weren't expected to live to be but about 58 years old. So it's improved for everybody, but notice that it hasn't really kept up with that. And I included a few slides on that because I thought that was really timely in the world we're living in today. But here's another factor. Somebody, I can't say everybody's names anymore because now you're all small, but somebody changed their last name to Income, right? That was somebody on here. Here's a slide to show, to kind of show how income might impact life expectancy. So this slide is showing that if you're 55 years old, but your income is in the poorest 10%, then we're going to add on 22 years to your life expectancy. So you'll make it 22 years beyond 55. But if you're in the richest 10%, you're actually going to live another 34 years beyond 55, statistically. I told you earlier I would show you a slide about how income aligns with life expectancy and health. So this entire graph across here shows the bottom x-axis. It's been a long time. That's the x-axis, right? The bottom axis is income, and the y-axis is health or life expectancy in years. So if you kind of look up at the top right, you'll see that the USA is in that level 4. Our income per person, the GDP per capita, is pretty high, and our life expectancy is just under 80 there, so around 78. But you will notice some other countries like Japan, for example, they have a little bit lower income per capita and live a little bit longer. But overall, it does graph out that the poorer countries like Central African Republic that we talked about earlier, notice that it's the only one, and this is from a couple of years ago, it's the only one that has a life expectancy under 50 years old in this graph. The other graph I showed you was just over 50. Somalia, Malawi, some of these countries. Education impacts your life expectancy. So that's why I said congratulations for being here today. Right now, you guys are all living longer just because you showed up today and you're learning more. But the fact that you're in school, let me show you how this graph works if you're not reading it. If you were, let's look at the red ones. The red ones are in 2008. In 2008, if you have a college degree, this last one, your life expectancy for white females is in the mid-80s. Where if you don't graduate from high school, it's down here at 70, 74, 75. So life expectancy, and that's changed a little bit over time. The blue one's for 1990 and 2000, but looking closer in today's world, how much education impacts your life expectancy. Now, of course, these are all multifactorial, because chances are if you have an opportunity for a college education, then you might also have an opportunity to have better food sources, maybe healthcare access, chance for a better job later, those kind of things that also impact your health. So speaking of jobs, let's look at another one. This are just some examples. Life expectancy by job category. So I'm doing pretty good on here as a college teacher. I might make it to my 80s. Does this surprise anyone? One story I like to tell, and in nursing school sometimes, is looking around the neighborhood when you see people with different occupations. Every occupation has an occupational hazard. So if you think of nursing, for example, and I'll use that one since that's mine, but I think this could apply to all of you guys are looking at careers in health sciences. So of course, right now, one thing we think about with health professionals is one of our occupational hazards is we're exposed to infectious disease. So as you know from the media, healthcare workers haven't had the personal protective equipment that they've needed in some of the healthcare settings that we go into. So they're at risk for infectious disease, but that's been true well before COVID. When I was in nursing school, HIV was brand new, and we didn't know how HIV was transmitted at the time. So when we went into work, we didn't know if we were at risk for getting HIV when we took care of a patient or not. So those are some of the occupational hazards of being a healthcare professional. We're at risk for needle stick injuries, but other things, one of our biggest ones is back injuries. So we lift patients all the time. So back injuries is one of our occupational health hazards. For me now, so I went into nursing so I wouldn't have a desk job. And then here I am sitting at a desk. And so one thing that I did is I bought a stand-up desk. But we know that sitting all day long at a computer impacts your health. Anybody familiar with the SDGs? These are the Sustainable Developmental Goals. So I want you to kind of take a look at them. We like to own this number 3, good health and well-being. That's probably my favorite one, but it doesn't stand by itself. It's not in isolation. Look at all these other ones. I mean, to me, when I look at every single one of these, I can connect them back to health and well-being. So that picture we looked at earlier, well, climate action, some of you guys mentioned smog, decent work and economic growth. We talked about job opportunities in that in that work environment. We didn't really talk about clean water and sanitation, but that one, we'll talk about that one in a little bit. What about gender equality? Does that impact health? So I actually showed you a graph where women tend to live longer than men. Sometimes that's related to different occupations and things like that, but that might have more to do with chronic stressors than necessarily genetics. So let me show you the next slide that's gonna kind of link all these in. So this one now puts good health and well-being in the middle and impacts those factors. So let's look at this one. This number 16 is actually the Sustainable Development Goal in the month. So let me back up and tell you what the SDGs are. The United Nations Foundation came up with goals and metrics of things that we would like to achieve. And truthfully, I don't remember the year. I know that we haven't achieved them, so we've had to extend them and work on them a little bit longer. But as a world, not just as a nation, not just the US working on these, but as a world, what kind of things do we want to concentrate on that is gonna give us a better global, not just global health, but just a better, what's gonna make a better world? And they came up with these 17 goals, the Sustainable Developmental Goals. And of course, then, like I said, I like to think of those as linking them back to good health and well-being. But this one shocks me. So let's do another chat room one. What do you guys think is the leading cause of death in the US? Without Googling, but just some guesses. What do you think is the leading cause of death in the US? Heart disease. You're already a nurse. Oh, well, you're almost a nurse. Heart disease, cancer, heart disease. Is this similar? Yeah, Chavez, this is definitely related to healthy people. So you should be doing that in community health right now, right? You and Ariana are both in community health. So exactly that. We'll talk about it a little bit more, but a lot of people put heart disease. Heart disease is number one, cancer's up there. So this is one I don't think you'll get unless you Google and cheat at it. What do you think is the leading cause of death in Syria? It's kind of a trick question because I don't think anybody will get it. Just put something there. Let's see. Leading cause of death in Syria. Lack of medical attention. I like it. Sarah, peer influence. That's your new legal last name. Lack of medical attention. What do you think? What would be malnutrition? So I was just getting ready to ask. Thank you, Rosa Community. Poverty. Sydney income. I was just getting ready to frame it. What do you think are more common causes of death in countries that are resource limited? It's different than affluent countries like the US. Usually affluent countries, it is heart disease. We have things like diabetes and cancer and things like that. But starvation. Nutrition is a big one. Another big one in other countries, dehydration. You really might be surprised. Thank you, Morgan, for putting that. Babies dying from dehydration is a common thing around the world. Very common thing around the world. One of the big reasons for that, though, is actually also infectious disease. So if you get an infectious disease that we typically are vaccinated for, but in a lot of countries, kids don't have access to vaccines like we do. So we're in the US, historically, we've been vaccinated at rates of 98, 99%. And that's changed a little bit because now you have a lot of parents that don't want to vaccinate their kids. And so our numbers have come down, and that's why we had things like a measles outbreak a couple of years ago. Something measles that hadn't been around the US we're now having. We used to have malaria here in the US. So malaria is a leading cause of death in countries like Nigeria. We used to have that here. If you go walk around campus whenever you're allowed to, whenever you're back on campus, we have a road called Quarantine Road, and we have tuberculosis used to be a big cause of death here in the US. That's still a big problem around the world. So those type of infectious diseases are still a big problem around the world.
Yellow fever. Yellow fever.
What's that?
Yellow fever.
Yellow fever, yes. Yeah, oh yeah, that's the one that is the one that has that road that goes down, right?
Mm-hmm.
Yep. So so trauma, war related. Thank you, Chavez. The leading cause of death in Syria is guns and violence. So Syria has been in a civil war for about 9 years, and the leading cause of death is guns and violence. Can you imagine that that's the leading cause of death, is guns and violence? So their life expectancy has actually decreased. Life expectancy for the most part has been going up over the last 50 years, and their life expectancy in that country has actually decreased. We're not going to school right now because of COVID and infectious disease. They're not going to school because it's dangerous, because of guns and violence, not because of maybe getting COVID. Isn't that crazy? Just to mention another country, Liberia, all right, another number, another chat room. Literacy rates. What do you think the literacy rate is in the US? The adults over 16 that can read and write at a 8th grade level. That's close to the definition. That might not be exactly it. What percentage of adults in the US do you think can read and write that we report? On a scale of 1 to 100, give me some numbers. 90%, 85, all good numbers. Everybody said pretty high. Somebody said 65, 90, good numbers, 70. Numbers may be lower than we report, but we report, you know, that we're about 99% literate here in the US. In Liberia, let's just go with women, because we're going to go back to that gender influence. What do you think the literacy rate is for women in Liberia? Their literacy rate? 40. Morgan gets extra credit there. It's 37. 37%. You guys are almost right on with that. Now that's for women. For men, it's closer to 67. So around the country, it's like 50%. So that tells you that men are getting more opportunity to go to school in Liberia. But one reason their literacy rate is so low right now is because they were in a civil war for like the 9 years, and they're trying to bounce back from that. So you wouldn't think of those factors as impacting each other, but that what I was going to say is number 16, which is the SDG of the month, is peace and justice. So clearly, without peace, we can't have good health and well-being. So clean water and sanitation, that one seems like an obvious one. We can't have good health without clean water, right? This is one of my favorite questions. So I ask it, so I probably already asked Chavez and Ariana, so they already know the answers maybe, because I like to ask. This is like my cocktail party, like conversation starter. How much water per person in liters do we use in the US? And then do a slash, and how much in Haiti, do you think? How many liters a day do we use in the US? And this is for everything. This is for agriculture, washing clothes, brushing your teeth, cooking, taking a bath. How many liters a day do we use per person in the US? And then how many liters a day do we use in Haiti? You guys have been pretty good guessers so far. Morgan says 30 in the US, 30 liters a day, 3 in Haiti. So definitely thinking there's a disparity. That's a good guess. I'd probably put that up there for that reason. 40 liters and 5, 20 to 1. When I was in Haiti, it was interesting, 50 and 20. A lot of the houses, we think of it as being like a greenhouse here. And all the houses in super nice neighborhoods collect water because it's the cool thing to do. In Haiti, they collect water because if they don't collect it running off the house, they have to go get it and bring it. And water weighs 8 pounds a gallon. So 8 pounds a gallon they'd be carrying. All right, so nobody got close. Nobody got close. Thanks for guessing. How much water per person per day in liters? I think I put it on a slide. Let's see. In the US. 550. 550. That's how much water we use in the US. And in Haiti, it was around, I think it's around 10. Rwanda, Uganda, Mozambique, around 10. Huge difference there. One thing in my global health class, I like to ask the students to gather a picture of women or children carrying water. So just Google this at another time. Just Google children around the world carrying water. You'll come up with some beautiful pictures. But then think about again that I mentioned that water weighs 8 pounds a gallon. A lot of times they're carrying on their head. They actually have back injuries, neck injuries related to that. Sometimes women get assaulted on the way to the well. children get kidnapped on the way to the well because that's their job to go fetch the water. I have 4 kids, so I was thinking, okay, if I had to bring home enough water for my family and we're using 500 liters a day, man. All right, I mentioned this earlier. We're getting close to the end of the slides here, and then we'll do some questions. Maternal mortality is down 45% globally. This is one that global under 5 mortality rate has dropped 59% since I was in nursing school. That's awesome. I think it's great that it's dropped that much. We've made great strides. When I was in nursing school, one child, and I should give you context. I think I told you when I graduated. So I graduated in 1989. I've been a nurse for 30 years. I did say that at the beginning. So 30 years ago, one child around the world died every 20 seconds. I'm sorry, every 11 seconds from a vaccine preventable disease. One child around the world, every 11 seconds, died from a vaccine preventable disease. Now that number's 1 every 20 seconds. So that's today. That's still 1.5 million children around the world that die from a disease that they wouldn't have to die from if they could have a vaccine. So Leanne may have told you, maybe not, because I let everybody in and didn't do introductions, that I'm very involved in the UN Foundation Shot at Life campaign, which allows me to do local actions that impact the entire world. So this new term, glocal, and glocal is something that has both local and global considerations. This is an easy thing to talk about right now with COVID. It's pretty easy to see that if somebody in China has COVID, how quickly somebody in the US could have COVID. So think about how quickly that spread. We now know with global air travel that it takes a disease could travel around the world in less than 30 hours. So if a disease hopped on a plane, we could all have that. So one thing about vaccines, of course, I'm a big fan of vaccines because one, they work. So we've eradicated things like smallpox. It doesn't exist anymore. I don't actually have a smallpox vaccine scar, but people just slightly older than me, like my siblings, have a gigantic smallpox scar. And it's from the vaccine that they used to get when they were little. The reason I don't have one is I don't need one. We actually wiped smallpox off the planet. Polio. You guys probably rarely hear of polio. It probably sounds like some ancient disease. Well, when I was little, one of my childcare, the people that helped take care of me had polio. She was a polio survivor. Polio, since I was in nursing school, has dropped 99%. I think, did I put a slide in here for it? Oh, I didn't. That was something I did this morning. I was thinking about it. I had a picture of 2 globes that showed where polio was 30 years ago and where it is now. Well, here's the good news. Polio is now only existing in 2 remaining countries. That's it, 2 remaining countries. This is still in Pakistan and Afghanistan. So what we have to do when we have a chance in our lifetime is to help wipe polio. Polio is only transferred human to human. So if we wipe it out of human contact, it's gone forever and we won't have to have polio again. But in 30 years, it's decreased 99%. So part of the reason that I'm involved in vaccines is to reduce inequalities. All my children had access to vaccines, and I would like every parent around the world to have an opportunity to choose to vaccinate their kids. And that comes along with SDG number 10, reduced inequalities. But if you want to look at that, I mean, that's kind of a unselfish way of looking at that. But if I want to be selfish about it too, as we talk about COVID, I know that if others aren't vaccinated, if they don't get vaccinated for measles, if they don't have that opportunity, then they can bring measles back into my house, for example. Things like Ebola. Do you guys remember the Ebola crisis a few years back that started in sub-Saharan Africa? That can quickly leave that country and spread around the world if we don't have infrastructure for vaccines right there in that country. So by promoting global vaccine programs, not only are we promoting better health for those in Africa, but we're also protecting ourselves by helping countries be able to respond to things like that and to respond to things like COVID. So, I did put it, this is what a smallpox vaccine looks like. I do not have one of these. I barely missed it. So this is my last slide. and then I'll give us some time to ask questions and things. What I wanted you guys to know is that this month, World Polio Day is coming up toward the end of the month. And I'm getting on the phone and I'm calling my congressman. So this is something I'm doing locally to impact health globally. I'm calling my Congress members, Senator Kane, Senator Warner, and then my congressperson is Representative McEachin. But in Virginia Beach, we also have Representative Loria and others around the area. And I'm letting them know that I want the US to maintain funding for global vaccine programs. So you can do something easier than that. If you want to, I don't know, screen capture this or something in case you're interested in it. If you text vaccines to this number, then it'll give you a feedback where you can put your data in, your zip code. And if you choose to, you can then send a letter that'll go directly to your congressman that says, I support global vaccine programs. So what we're asking them to do is protect funding, which is it's not even 1% of the budget. It's less than 1%. But we're asking them to protect funding for global vaccine programs. And it's a good investment. The return on the investment is actually about $50 to $1 per vaccine. So that's pretty easy to think about in COVID. You guys know that during COVID, sometimes people can't go to work. Well, that impacts our economy, right? If you miss a day from work. So you can directly link that to economy, things like that. But anyway, I could speak about that all day. If you are interested, we have a guest speaker, and I can share this link with Jacob and Brittany. And we have a guest speaker coming on Monday the 19th, I think at 11 a.m. So I don't know if you guys have class.
If you click on the link that I just posted in the chat, it's actually the link to the flyer.
Oh, awesome. All right, you got it. So you have it. So I don't know, is that one of the one of the learning?
Nobody has a learning community class at 11 on Monday. You might have another class, but you definitely don't have a learning community.
Okay, all right. So if you guys want to come to that, Chavez and Ariana will be there, right? Is that your class?
It's my class, I think.
Okay, so
on Monday. I'm pretty sure.
Oh, that's right. That's right. Ariana, you're a senior. Ariana's a junior. That's right. I've already promoted you, Ariana. I've already made you graduating. So your class, Chavez, if you guys want to come to that, we actually have guest speakers from UN Foundation who are plugged into these global vaccine programs, and you can learn a lot more about, number one, about what vaccines do and how well they work. But if you choose to be an advocate for vaccines, what you can do, small things, it could be social media posts, but things that you could do that might be to call your congressman or to do a tweet that highlights, that says, hey, I support global vaccine programs. What they'll share with you is even a toolbox to show you how to do some of those things. We're gonna be meeting with Congress members via Zoom later this month, and you guys could certainly join in on that too. If you come on Monday, we'll share the dates that we have meetings set up, and you can join us with those meetings to see what that's like. You don't have to speak if you don't want to speak. You could just be there. If you can't come Monday to this guest lecture, that'll be Monday the 19th on the link that Leanne shared, then email me separately. My email, I'll put in the chat box here. You can also email me and I can show you other ways to get involved with that. There's training that happens once a month related to that. So that is the end of all my talk. What questions do you guys have? I hope some. You can either unmute or let's quit sharing the.
Well, I have a comment for those who are in my class. How timely is this? I should have known it would have connected to what we're talking about. We're talking about the progressive era, and we're talking about reforms in housing, and food safety, and air quality, and water quality, and so everything that Dr. Hawkins talked about are things that 100 years ago were issues in this country that people just like us said, we can fix this, we can make this better, and they have. And if you look at the life expectancy in this country in 1900, it was around 41 or 42 years in age. And by 1950, it jumps up to almost 60 years in age. So that is the impact of the changes. And you can still see from what we talked about how it still varies to this day across the country. So I want those of you in my class to try to put everything we've been talking about together with our health realities today. So thank you, Dr. Hawkins, for doing it for us.
The shocking one to me is how life expectancy varies across our own country. You know, that if you live in Fairfax County, Virginia, you might live to be 80 years old, but if you're from McDowell County, Virginia, it's more likely going to be 65. That's a 15-year gap. But I've been to McDowell County several times, and I know that there's not a lot of opportunities within that county for access to some of the food, jobs, things like that, you know, that honestly I have access to and my kids have had access to. Questions from you guys? Any comments? Anything that shocked you besides the leaders? That had to shock everybody, the number of leaders we use. Anything that shocked you?
So if you want to speak the chat, if you don't want to talk, you can still chat your answer.
Mm-hmm. Even Ariana and Chavez, did
I just want to make a comment.
I know you guys have heard a lot.
I wanted to make a comment.
Yeah, go ahead.
This kind of reminded me of studying abroad, and I know a lot of the students in this group are interested in that. I remember before we went, we were looking at some of these social determinants of health and looking at how it is related to the US and in Ireland. And I remember when we were driving through the town, just the roads weren't as paved. It was a long ways to the grocery store. People had farms outside of their houses. The water was, you know, just looking at the difference, it just reminded me from study abroad. So I would, you know, all of you students interested in studying abroad, just kind of take this with you, because you'll be using this when you take that class and observing these things when you choose to study abroad. So I just connected it, just thought it was interesting.
Mm-hmm. I think that's a great connection, Chavez, because not even just connecting it, like, you know, we went to, and Ariana, sorry, because I know you didn't get to go, you were planning to, so bummer. But Chavez, when you think about that rural community in Donegal, I mean, that's really not that different than maybe rural communities in the US. So those same rural communities don't have access to, you know, a tertiary care center that can, you know, have a helicopter to us in 30 seconds for those types of things. So it's just different, even in the US with rural communities.
I was going to kind of add on to that. I'm in Professor Lopez's sociology class, and he was even telling us a story how he was like, oops, sorry, my Siri went off. He was telling us a story how he was in like rural Alabama, and like the nearest grocery store was like just a Dollar General, and it was like a 35-minute drive, and it didn't even have like fresh produce. And he was saying like how it's crazy from where he's from in Norfolk, there's like 5 different grocery stores around him, but then you go to like rural areas and like you see people who like aren't living as long and aren't in as great of shape, and like they only have access to one grocery store, and that one grocery store doesn't even have like the necessities like fruits and vegetables. So it's interesting to see it in like different classes too.
One place I traveled pretty often, used to travel to pretty often, is El Salvador. I go there also with my church, and it's very uncommon to see somebody exercising. So a couple of you change your last name to, well, Jacob Exercise. And I think about it, and there's like, there's not, you know, you see even in downtown Norfolk, all the bicycle routes. So those are put up. And then Virginia Beach has great infrastructure for riding bicycles on trails. But when I think of El Salvador, the roads, you're going to be riding on the road. So the chance of a traffic accident, which actually accidents are in some resource limited countries, accidents are often in the top 10 cause of death. And if you'll note, one thing when I travel, Chavez, we didn't see this as much in Ireland, but I think Ireland is a more affluent country. But in other countries that I see, like El Salvador and Ghana that I went to, seatbelts not as common. Motorcycle helmets, not as common. Riding on a motorcycle, no kidding, might be like 5 people. So those types, so car seats, I mean, we don't put our kids in a car without a car seat, but in more resource limited countries, it's very common that you've got to get your kid to school with whatever means you have. And it might be riding on the back of a motorcycle. So just things like that you don't think about that are safety initiatives. Those lines on the road that you guys are used to, Those didn't happen until that was actually a Eleanor Roosevelt initiative, and I know that sounds like a million quadrillion years ago, but it really wasn't that long ago that we had lines painted on the road to help us stay on the side of the road. So different safety initiatives. Some might put infrastructure as their last name, and those types of things are infrastructure that improves safety. Good comments. Other comments? Anybody watch Place Matters and have any surprises there?
I had a comment aside from the place matters. You just brought up how just in the US, every state has their different life expectancy. And I just want to bring up, like, back in high school, I watched a video and it was based off of the mortality rates of women, like pregnant women, and especially in Georgia. I don't remember the rates or the city, but a certain city in Georgia, there was only like one OBGYN. And so a lot of them couldn't even get access to it because it was so filled up. So many pregnant women had to travel about like 45 to an hour away from where they lived to just find a doctor to help them. And it was just talking about how many women actually died just trying to give birth in the car, or any type of infection they received because they didn't have any access. So it was just talking about like how Georgia is like going down and or really high up in the mortality rates for pregnant women.
Mm-hmm. Yeah, and I would venture to guess that that was in a socioeconomically depressed area. And if you think about it, think about McDowell County. When somebody gets a chance to go to school, and then they want to raise their kids in an area where their kids are gonna have a life, they want a better life for their kids, right? So if somebody grows up in McDowell County and gets a chance to go to medical school, chances are they're going to move out of McDowell County into a more affluent area. So even that I put Sumter as my hometown. When I went to school, I could tell you that in the college prep classes that I was in, most of my Black friends that got a college degree didn't stay in Sumter. So most of them moved out of Sumter and went to areas that were had better opportunities for them and their families. But then that still leaves Sumter with having some of the same disparities that you mentioned as in Georgia. Well, Sumter's a little bit bigger town, but the same type of disparities.
So voting then is also tied to this then, right? Because if you watch anything on the television, you're hearing people in their campaign points, and the closing of rural hospitals is definitely an issue, and whether or not lawmakers are going to make sure that tax dollars are spent to help keep some of these places open. That, as well as moves toward telehealth and telemedicine. So can you connect those things maybe too?
There's another cool thing to Google. There's a website called gapminder.com, and you can go on Gapminder and type in things like physicians per person, and it'll show you a world map, but it will shrink it or swell it up based on how, like the US healthcare providers per person is going to be really fat, and places like Africa again is going to be really skinny. You can even type in like cell phones per person, which actually cell phones is pretty distributed pretty globally. But that's a cool one. It's called gapminder.com. Other comments? I love talking about this, so I'll probably just hang here until no one else has left. So, thank you, Jacob. So, and there's Ariana also shared that article. I think I would go back. I hope some of you guys are just like, what would be thrilling to me is if you walk out of this conversation today and you want to learn more. And then you go look up some of these things, and that you just have a continual quest for thinking about, number one, what are factors that impact health? And then to shift it to what Leanna's kind of been emphasizing, what can you do about that? And you have an opportunity to impact that with things like with voting, with policy making. I always think of nurses as being fantastic advocates. I think Ariana and Chavez would agree with me that advocacy is something we teach from day one, but we do sometimes think of advocacy for our patient in the bed. and not always as much about advocacy for the entire communities that we serve. So that's something that I hope you guys are starting to, you do that in community health, and Ariana, you'll do that in community health later too, but we start to think about, I know with Ms. Tremblay, she talks a lot about how we can change community health for entire communities.
So that's a perfect segue to what I just posted, which is our next learning community talk, which is going to be led by another nursing faculty member, Dr. Janice Martin. There's a link to the flyer there. But it really is going to tie together the New York Times article that Dr. Hawkins talked about in terms of maternal mortality rates and racism being impacting that. Dr. Martin's going to talk about inter and intraculturally informed healthcare. And so she wants you to read another New York Times article on bad medicine that Professor Lopez is going to talk about in your social class, because you'll be talking about race just as a component of your sociology class. So it'll tie hopefully everything that we've been talking about and continue the conversation on the 28th, also at 3 o'clock. So mark your calendars.
And now I have to decide who won. Is that the?
I think Ariana, now it's time for the not grand prize. We're not to the grand prize yet, don't worry. For the first prize drawing, Ariana has entered. Those of you who submitted your pictures of all the activities you've been participating in, snap a photo right now of this one, because you can enter this one in for the next prize drawing. If you didn't snap a photo while Dr. Hawkins was talking, snap a photo of all of our lovely faces on the screen. And then enter it in teams. But Ariana, take it away. What are we drawing for?
We're drawing for the nice, fancy ODU wallet phone holders. There's a fancier name for it. I'm blanking. They're really nice. They have the ODU logo on them. Fancy stuff, guys. Yes.
Oh, yeah.
That's what Dr. Hawkins has. They're great, super convenient. Like I said, the ODU logo. Great feature here. So I went ahead and inputted everybody's name multiple times if you have multiple submissions into a spinner website. So I'm going to share my screen so y'all can see. Can everybody see? I should have made this bigger. And then we're going to do another drawing for the same prize. So there'll be 2 winners this week. So get excited. If you didn't win, maybe this is your lucky chance. Second time could be the charm for you. Oh, that was so close. I like how they have the clapping and stuff. It really, makes it fancy.
Awesome. I don't see Spencer here today, but I do see Tierica. So yay, congratulations. We will get our mentors to connect with you.
Yes, your peer mentor will contact you and we'll work on a way to get that prize to you. But expect a chat from them through Teams.
I think we have a total of 12 prizes. Does that sound right? For the course of the semester. So those are just the first 2. So keep entering your activities in this semester, and
It'll only get better from here. Like that's a great prize, but it'll go all the way up to fancy beats. So it's neat. And also just make sure your submissions, the benefits program is separate from the Capture Campus. So if you're submitting pictures of you at the library or at the gym, that doesn't count towards the benefits program. That's for Capture Campus. So.
But anything academic, anything where you're meeting with a tutor or your peer mentor or anything like that, you can be submitting, or any learning community event, you can submit those for the program, for the prize drawings. All right, can we give Dr. Hawkins, Dr. Food Deserts a a round of applause and just say thank you so much for talking with us. I hope you got me thinking about some more stuff. Hopefully has you thinking, and I hope you have a great rest of your Wednesday.
I enjoyed it, guys. Thanks for coming and for also being real. It would have been kind of awkward if I'd have said do something in the chat and it just sat there. So thanks for playing.